So welcome to Toowoomba Family Vets. Today we're going to give you a bit of a behind the scenes tour of the hospital and what to expect if you bring your pet in for desexing. Desexing is one of the most common procedures done at a veterinary clinic, and we want to take this opportunity to give you a bit of an experience of what happens once your pet is left with us. This will hopefully make you feel a bit more comfortable about what goes on and know that your pet's in good care and that we're here to make the process as smooth as possible. So once you come into the doors at Toowoomba Family Vets, you'll likely meet either Beck or Phoebe at the front door. What they're going to do is they're going to get some details from you. So just to make sure that your dog or cat hasn't had any breakfast, we'll then weigh your pet and we'll answer some other questions just to make sure that we're all good to go for the surgery today. So after being admitted to hospital, one of our vets is going to have a much closer look over your dog or cat. What we're doing is we're listening to their heart, feeling their pulses, looking at their gums, listening to their breathing. All of these things just to ensure that the anaesthesia and the procedure is going to go as smoothly as possible. After that, your dog or cat is going to get some pain relief and some sedation. This makes the whole process a lot more smooth for your dog or cat. It also drastically helps with our anaesthesia. So pain relief can help with making sure that your pet stays nicely under the anaesthetic, as well as making them comfortable and pain-free during the procedure and on recovery. So after your dog or cat has got some pain relief and sedation, our vet and nurse will move to the next stage, which is getting an IV catheter in. So the IV catheter is a really important process of the anaesthesia. This gives us the IV access so that we can administer drugs as well as IV fluids. So all of our patients undergoing any procedure under general anaesthetic at Toowoomba Family Vets will receive IV fluids throughout this process. Once we've gained IV access and taken a little blood sample from your pet, we're also going to make use of our blood testing machines. So our minimum base blood test is included in all our anaesthetic pricing. This makes us feel a bit more comfortable about anaesthetising any animal, so we do include this as a standard. If your pet is coming in to Toowoomba Family Vets for an anaesthetic and they're more than 5 years old, we will also offer a more inclusive blood test. And this is really just to make sure that we're not missing anything and that the anaesthetic will go as smoothly as possible. So once we have IV access in your patient, we can move through to the next stage, which is giving them the general anaesthetic. So once we've given the anaesthetic medication into the catheter, we can then move on to intubating the patient, which secures the airways and enables us to keep high concentrations of oxygen, but also our inhalation anaesthetic. Once they've been anaesthetised, this is the really important part for monitoring the patient. So we have invested in state-of-the-art anaesthetic monitoring in the hospital. So while they are under the anaesthetic, we do monitor them particularly closely with our anaesthetic monitoring machine demonstrated here. This gives us a really close eye on blood pressure. We keep an eye on the ECG monitoring, their blood oxygenation concentrations, as well as the end-tidal carbon dioxide. All these things help us to keep your patient stable throughout the anaesthetic. On occasion, we also include invasive blood pressure monitoring. This is normally reserved for our more critical patients where we're particularly concerned about blood pressure. So here's Beck putting in an arterial line. This can be connected to our anaesthetic monitoring, which gives us real-time, very accurate measurements of our patient's blood pressure. This also gives us the opportunity to monitor the blood arterial oxygen concentration, which again gives us a really nice picture of how well our patients are oxygenating their blood. So once your patient is anaesthetised and we've got them stable under the anaesthetic, all of our monitoring, our nurses will move through to the preparation stage for surgery. So given the fact that we are often entering the abdomen for a desexing, we want to make sure that we're as clean as possible in this procedure. So this involves aseptic preparation of the incision site, and Beck or Phoebe will be involved in clipping and preparing this area for surgery. Okay, so once the patient has been prepared for surgery, We will then move on to the scrubbing in phase, so where our vet or surgeon will prepare themselves for sterile surgery. This involves initially us scrubbing our hands and then in a sterile manner getting our gown and gloves on. We find it particularly important, even for routine procedures like an ovariohysterectomy, that we prepare ourselves as cleanly as possible, because even though it is a routine procedure, we are going into the abdomen, and it is of utmost importance that we remain sterile as possible throughout this process. Okay, now our surgeon's going to move into theatre. The guys have got our patient onto the operating table and have got transferred all the monitoring equipment into the theatre. Now we will put our sterile drapes over the surgery site, and we will be able to keep this area as clean as possible throughout the entirety of the surgery. This is a pretty special room, this one, so we reserve this room for all of our sterile procedures. So all of our staff, nurses, anaesthetists and surgeons will be gowned up to minimise any bacterial contamination to the surgery site. So we'll run you through the actual anaesthetic monitoring machine that we've got here. So this is a BM5. You'll be able to see lots of lines and squiggles going across the monitor here. So basically this does give us a really good indication of the patient's blood pressure. Not only the end-tidal carbon dioxide, but also the rate at which they're breathing, and gives us a bit of a pattern of how deep their breathing is. The blood oxygen saturation is a really important one, just so we know that their oxygen levels are where they need to be, as well as the ECG. So it is uncommon to have ECG abnormalities under the anaesthetic, but they do happen, and that is why we do need to keep a really close on that. The ECG also gives us a really good indication of the patient's heart rate as well. That way we can also tailor our pain relief and anaesthetic to make sure that we're at a good depth and that your patient is as stable as we can make them throughout the process. So when we're finishing up with surgery, we do always use absorbable and intradermal sutures for our closures. And although we do like to see your patient back for a checkup 10 days later, there won't be any need for any suture removal. We do find the intradermal absorbable sutures particularly useful, as well as being a great closure for the surgery. They also make it a little bit less likely that our patients are going to chew at the suture line, which can help with recovery. If you have any more questions about that, feel free to ask us when your patient is admitted. Okay, so here we have Phoebe just recovering our patient from the anaesthetic. This is arguably one of the most important parts of the process of the anaesthetic. This is the part where we take them off the machine so they're no longer breathing the higher concentration of oxygen, and we really need to make sure through this process that they maintain oxygenation levels and that they're breathing adequately for themselves. Well, we really hope that this has given you an appreciation of what happens behind the scenes when your pet gets desexed. As you can see, we don't take any anaesthetic lightly in our hospital, and we do provide exceptional standards of care when it comes to anaesthetic monitoring and surgery for your patient. So we've got a great team here dedicated to your pet's health and well-being, giving you confidence that your dog or cat is in great hands.